Hello guys, from today onwards we are going to start with the pathologic basis of kidney. So we are going to cover individual system from renal, kidney and all the hematology. Every system we are going to cover the pathologic basis based on the Robbins textbook of pathology. Okay, so we'll shall begin this topic with the basics of kidney and what are the pathology that can occur inside of a kidney and how everything is regulated. So basically we'll first move on to the function of the kidney. So what do we have? Kidney has mainly three main categorized functions. So firstly we have the excretion of the waste products and waste products of the metabolism. So that's one function of the kidney. Then we have the regulation of body's concentration of electrolytes. It will regulate the body's concentration of sodium, potassium, magnesium and the bicarbs, chloride, everything. All the electrolytes regulations is done by the kidney, and basically it is the best for the acid base balance, because the error in acid base balance by the kidney is equal to 0. So afterwards it also has some endocrine metabolism, such as it secretes erythropoietin, which helps in the formation of new red blood cells. It also secretes renin, which helps in the maintenance of any hypertensive disorders, and we also have the vitamin D metabolism from the kidney. So these are the three basic main categorized uh, work of kidney. So moving on to the disease of the kidney. So basically if there is any disease of the kidney, there should be a distinctive injury to each or any of the components. So how can we divide the kidney into 4 different components? We can divide it into, primarily it can be involving only the glomerulus, or else it could also involve the tubules. It can involve the injury of the interstitium, okay, and finally it could involve the injury of the blood vessels. So these are the 4 categories or 4 components where the disease of the kidney can occur. So we can have a blood cell coming out and from here, then we do have the glomerulus resulting into the tubules, followed by this is the interstitium. Okay, so these are the main diseases that we can see in a kidney. Okay, so it can either involve the glomerulus, it can involve the tubules, the interstitium or the blood vessels. So any of the injury can lead to the further pathologic diseases of the kidney. So if there is any distinctive injury to the kidney, how can it clinically manifest into the symptoms? We'll first see. So primarily for the first one, I'm going to tell you is something called as azotemia. So what is azotemia? Azotemia refers to increased blood urea nitrogen. Okay, azotemia refers to increased blood urea nitrogen, and this is primarily due to a reduced GFR, we can say. Due to reduced GFR, there will be increased blood levels of urine nitrogen, and also we can also call as creat levels. Okay, creatinine levels. So the causes can be either pre-renal or post-renal. What do you mean by pre-renal? We'll tell pre-renal when it is majorly due to hypoperfusion of the kidneys. Okay, it is pre-renal when it is due to hypoperfusion of the kidneys, and we'll call it post-renal when it is due to obstruction to the urinary flow. When there is obstruction to the urinary flow, we'll call it the post-renal. What are some of the causes of pre-renal that you can say? It can be due to hypotension, and it can be also seen in congestive cardiac failure, in the cirrhosis of the liver. In either of these cases, there is reduced circulating blood volume. It can be due to hemorrhage, which will lead to reduced blood volume, and again pre-renal cause of azotemia. In post-renals, it may be due to obstruction. Obstruction can be due to the renal tumors, or it can also be due to the urinary stones. So these are the main causes of post-renal, and these are the pre-renal. This leads to azotemia. So when this azotemia is primarily present, but there is no clinical signs and symptoms, we'll just call it azotemia. When this is involved with the clinical signs and symptoms, then we'll call it, what do you call it? As you all know, we call it uremia. So when the azotemia leads to clinical signs and symptoms, we will call that uremia. So what is uremia? Uremia is again the same, elevated levels of blood urea nitrogen, but this time it is due to failure of the renal excretory flow. Renal excretory function. When the renal excretory function is fully compromised, it leads to uremia, and this will lead to the biochemical abnormalities. And whenever this uremia leads to secondary involvement of the other systems, it can followingly affect what we call as uremic gastritis. When it involves the GI tract. Then it can also cause uremic peripheral neuropathy when it involves the CNS system, or it can also cause uremic fibrinous pericarditis. Okay, so this is when it involves the CVS system. So we do have azotemia, which refers to increased level of blood urine nitrogen, which is mainly due to the reduced GFR and also elevated creatinine levels. It can be either due to pre-renal or post-renal. Pre-renal is due to hypoperfusion of the kidneys, which might be from hypertension, cardiac failure or cirrhosis, or it could be due to post-renal when there is obstruction to the urine flow. When this azotemia is associated with the clinical signs and symptoms, we call it uremia. And uremia, this is mainly because of failure of the renal excretory function, and when the uremia affects other systems, it can also result in uremic gastritis, peripheral neuropathy, and fibrinous pericarditis. So this is one feature of the clinical manifestations due to the renal injury. The second one we can call is nephritic syndrome. So this nephritic syndrome is primarily due to inflamed glomerulus. So nephritis syndrome is primarily due to inflamed glomerulus, or it can also call it as a glomerular disease. Okay, this is a glomerular disease, and this will majorly results into or grossly results into a very reduced GFR. That much you can say. In this, what are the clinical symptoms we have? We have hematuria. This can be either gross hematuria. We can see the red color of urine coming out, or it can be microscopic, and then urine color is normal, but when you analyze through a microscopic, we can also see a dysmorphic RBCs. We have the dysmorphic RBCs as well as the red cell casts in the urine. So that much you can see. Then nephritic syndrome also results in mild to moderate proteinuria, usually less than 3 grams per day. And the major feature is, of course, the hypertension, which is a secondary hypertension that is not responding to the tablets. Then you have to think there is nephritic syndrome. What's the most common clinical presentation? We have something known as acute post-streptococcal glomerulonephritis. So post-streptococcal pharyngitis, after some 1 or 2 weeks, it results in the kidney injury, resulting in the nephritic syndrome. The other one is called as the RPGN, which is nothing but as the rapidly progressive glomerulonephritis. Don't worry, we are going to discuss each of these topics in detail. So currently, remember, nephritic syndrome, we have 2 clinical presentations. We have the acute post-streptococcal glomerulonephritis followed by rapidly progressive glomerulonephritis. What happens in this? There is rapid decrease in GFR. The rapid decrease in GFR within hours to days. Within hours to days, there is rapid declining in GFR, and that is RPGN. Okay. So this is about the nephritic syndrome. Moving on to the nephrotic syndrome. This is another clinical presentation, nephrotic syndrome. This is also due to a glomerular disease, also affecting the glomerulus. Okay, but in this we have something called as the heavy proteinuria, which is generally more than 3.5 grams per day is lost. Okay, it also results in hypoalbuminemia. Because measure of the protein that is lost in the nephrotic syndrome is albumin, and this in turn leads to severe edema of the body. This results to anarchy of the body. There is periorbital swelling, lower limb swelling, ascites, etc. Then this also leads to hyperlipidemia and lipiduria as well. So lipids are present in the urine. That is known as lipiduria. So this is about the clinical features of the nephrotic syndrome. In this condition, the hypertension may or may not be present. Okay, hypertension may or may not be present. Okay, this is another clinical symptom, clinical representation of the renal injury due to pathologic diseases. Another we have there could be just asymptomatic hematuria or proteinuria, which should be further evaluated. Then there could be acute kidney injury, or earlier we used to call it as acute renal failure. What happens in the acute kidney injury? We have a rapid decline in the GFR. There is rapid decline in the GFR, that is within hours, 2 days. That results in acute kidney injury. So eitherly what happens in the acute kidney injury AKI, there is dysregulation of the fluid balance. Okay, fluid balance is lost, and it also leads to retention of water because the GFR is grossly reduced. So this acute kidney injury can be due to the glomerular disease, or it can be due to the tubular, interstitial, or vascular. Okay, any of the following will be affected and might directly result into acute kidney injury. Then further, the disease can progress, leading to chronic kidney disease. We call it as CKD, and this is due to the persistently decreased GFR. Is due to persistently decreased GFR for more than 3 months. Okay, and the GFR is grossly reduced to less than 60 ml per minute per 1.73 meter square. What is this? This is the body surface area of a man. So GFR is grossly reduced to less than 60 ml per minute, and for more than 3 months, then it results into chronic kidney disease. This is actually an end result. This is an end result of chronic renal parenchymal disease. Chronic renal parenchymal disease. This is the end result, and the signs and symptoms of chronic kidney disease is mainly the signs and symptoms of uremia as well. Then it can the clinical presentation of the kidney can also lead to ESRD. What is ESRD? This is the end stage renal disease. Okay, and in this happens when the total functioning of the kidney is less than 5% of normal. This results into end stage renal disease, and the patients must be maintained on hemodialysis. And further, it can also affect the tubules. As I can say, it can appear that we can call as renal tubular defects. In this renal tubular defects, the symptoms of the patient will be polyuria. It can be nocturia, and you could also suffer from electrolyte disturbance. Okay, or it can also be result into acid-base disorders such as acidosis or alkalosis, whatever. Okay, these renal tubular defects can be either inherited or acquired. Some of the inherited renal tubular defects are known as cystinuria. This will study in biochemistry. Then we also have the renal tubular acidosis, also something called as familial nephrogenic diabetes mellitus. Okay, that's inherited. In acquired conditions, we have something called as lead nephropathy. This is due to overexposure to the lead. Then another manifestation of the kidney injury is urinary tract obstruction. This happens whenever the urinary tract is obstructed, either with a renal stone, or there is a stricture formation, or it is obstructed by some renal tumor as well. This can lead to urinary tract obstruction. It can also cause the post-renal, what we said, azotemia and further diseases. Okay, so this is about the urinary tract obstruction. Most commonly it is renal stones, that is nephrolithiasis we call it, and it can be due to renal pathologies. So this can further, because of this stone, the infection might ascend up, leading to pyelonephritis. Okay, pyelonephritis, or it can go down, leading to infection of the bladder known as the cystitis. So this is the basics of the pathologic disease of the kidney. Okay, this is what you have to know primarily, that is the functions of the kidney and what all it can affect. It can affect either glomerulus, tubules, interstitial blood vessels, or any of the clinical manifestations. This is the basics: azotemia, which might lead to uremia, or the other something called as nephritic syndrome, nephrotic syndrome, then AKI, CKD, ESRD, and finally tubular defects, followed by urinary tract obstruction. So from this time onwards, we are going to cover each and every topic of the pathology of all the systems, and we'll cover it in detail. So this is a basic video one, and keep watching for further videos like this. Thank you guys. Bye.